Many people might not know this or might not realize it, but cancer isn't a disease only found in adults. While it can mainly be found in older patients, kids and teens can also get this disease. But wait a minute, let's slow down here. Before we can talk about child cancer, you must first learn about what regular cancer is. Cancer is a disease caused by an uncontrolled division of abnormal cells in a part of the body. To put it simply, cancer is when cells that are abnormal spread too quickly. Normal body cells grow and divide, but the difference is that they know when to stop growing, and over time, they will die. Unlike these normal cells, cancer cells just continue to grow and divide out of control, not dying when they are supposed to. Most people associate cancer with adults, yet they are unaware that child patients can also have cancer. I recently made a study in my city in which I looked at a total of 297 cases of cancer patients ages 0 through 15, whom were diagnosed at the Regional Hospital of Concepcion during the 10-year period of 2008 to 2017. Picture this. Say that there are a total of 2,000 kids at your school. According to the research I conducted in my city, there could be at least 2 kids who might end up with cancer at your school. That is if you live in Concepcion, Chile, like me. But say you live in the United States. That number of 2 kids with cancer could turn into a possible 7 kids. This is what is known as incidence, which is the number of new cases in a period of time.
110 y 150 casos de cáncer infantil cada 1 millón de jóvenes o niños. Esto es de 0 a 14 años. Entonces la incidencia mundial conocida de 110 a 150. En Chile la incidencia registrada es de 128. Por lo tanto nosotros estamos dentro de la media mundial.
There are many types of childhood cancer, but the 4 most common found in my research were tumors of the central nervous system, which is a collection of different types of cancer that all affect the brain and/or the spinal cord. Lymphomas, which is a type of cancer in the
immune system.
Soft tissue tumors, like muscles, fat, cartilages, and nerves, among others. And finally, leukemias, which are found in blood cells. These results align with most other countries, since their results are similar, just in a different order. Renal tumors, carcinomas, germ cell tumors, neuroendocrine tumors, retinoblastomas, liver tumors, bone tumors, and others are some of the different types of cancer associated with child patients. According to my research, I gathered that male patients are more likely to have cancer than female patients, with an average incidence rate of 83 per 100,000 children, beating the female patient's incidence rate of 65.8 per 100,000. Another thing I found in my research was that different age groups have different results. The age group with the highest incidence rate was the little kids club of 0 through 5 years of age, followed by the big kids group of 11 through 15, and lastly the middle group of 6 through 10. Well, you won't know for sure until you get checked up by a doctor, but there are specific signs and symptoms associated with different types of cancer. One of the most common symptoms found in cancer patients are adenopathies. These are an increase in volume of lymph nodes, which are what makes up part of the immune system. Another common symptom is to have morning headaches followed by vomiting. And the third most common symptom is abdominal mass, which is the increase of volume in the stomach.
Y lo otro, ¿no es cierto?, que hay algunos síntomas y signos que son de alarma del cáncer, ¿no? Por ejemplo, un niño que empieza a cojear, que nunca ha tenido, ¿no es cierto?, ha caminado siempre bien, y de repente, ¿no es cierto?, empieza con dolor de rodilla y empieza a cojear, ¿ya? Y entonces uno le hará una radiografía, ¿no?, porque la posibilidad de que si ese niño, ¿no es cierto?, es un adolescente, pueda tener un cáncer de hueso, ¿no es cierto?, es mucho más alto. Cuando uno ve la pupila blanca, lo que se llama la leucocoria, ¿no es cierto?, en un niño pequeño, si ve la pupila blanca, las posibilidades de que sea un retinoblastoma, ¿no es cierto?, es muy alta. Cefalea, por ejemplo, dolor de cabeza. A todo el mundo le duele la cabeza, ¿no es cierto?, en algún momento. Sin embargo, si ese dolor de cabeza se acompaña de vómitos, y sobre todo, ¿no es cierto?, matutino, habitualmente los dolores de cabeza por tensión, por todo eso son más bien en la tarde, ¿no es cierto?, pero si es matutino y el niño despierta, ¿no es cierto?, todo empieza a vomitar y le duele la cabeza, y no pasa, ¿no es cierto?, a través de los días. Obviamente la posibilidad de un tumor, ¿no es cierto?, del sistema nervioso central en el cerebro son altas.
I have good news though. In general, child cancer has a really good survival rate. Approximately 74% of kids with cancer survive. This means that out of 10 kids with cancer, at least 7 will survive. I hope that this video helped you learn more about child cancer and that my study will contribute along with other
epidemiologic
studies in Chile to improve the prevention, treatment, and follow-up programs in childhood cancer.